Welcome to HR Voices, a podcast for independent HR and people professionals and the businesses they support. HR Voices is brought to you by the expert team at HR Independence Limited. We hope you enjoy.
Hello and welcome to another edition of HR Voices podcast. I'm your host, Mary Asante. Unfortunately, my usual partner in crime, my co-host, Charlotte Alfrey, is not here today because she is at a conference, but I have got with me the amazing Magnus from Occupational Health Assessment. And we'll be talking today about all things occupational health. So nothing is off the limits. So stay tuned for a very interesting episode today. So welcome, Magnus.
Thank you, Mary. It's a delight to be with you. As if my ego needed any more fluffing to call me amazing. Honestly, I don't think there's anybody who knows me well that would agree with that. But especially my wife. You know, I'm sitting here in my dining room on a beautiful afternoon thinking, how can I make occupational health interesting? Because, you know, it is a strange area to end up as a specialist, and my wife's eyes glaze over whenever I talk to her about the joys and wonders of occupational health. I genuinely find it incredibly interesting. I will do all I can today to helpfully demystify some of the common issues and problems that you may face when you're working with occupational health, because, you know, having had 20 years experience supporting HR professionals, I understand what a challenging role they have within the businesses or supporting the clients that they're responsible for supporting. It can be an absolute tightrope sometimes. And the last thing anybody wants is to think of an HR specialist opening a report from an occupational health professional, their shoulders dropping and just thinking, why, oh, why did we go down this road? Because now I've got one hand tied behind my back, or heaven forbid, it's made things even worse than the situation at the start. So there are some common tips and tricks and some elephant traps to avoid that I will hopefully be able to guide you through. And if a good place to start is just exactly what is occupational health.
Absolutely. And that was going to be my first question, because like everything, we sometimes assume everyone knows something about everything or everything about something, and that's not always the case. So let's go back to the basics and address that issue. What is occupational health and why is it so important?
In its simplest terms, occupational health manages the impact of health on work or work on health. It is so important because, you know, the joyous pieces of legislation that govern the work we all do, health and safety legislation, working time directives, it is not all about the joys of the Equality Act. However, the piece that we focus on relentlessly is on supporting people who may have considerations around the Equality Act. So the kind of occupational health where if you have people who are climbing telegraph poles or working in glamorous locations like sewerage tunnels, I don't know why I thought of that one now, but there we are. That is a very different kind of occupational health. And that is where you are managing risks that are known, understood, and present. And the right way to deal with those sorts of things is to do a risk assessment, engage with an occupational professional to make sure you are understanding and managing and mitigating the risks appropriately. But our focus almost entirely is on, you have a health issue that's just blown up with one of your clients. What on earth are we going to do? That's the area that we provide support.
Thank you very much for sort of breaking it down in a way that I hope, or I'm hoping most of our listeners will really understand. So it's really about a health issue that may be raising concerns. And I think it's important to highlight that those health issues can be existing conditions or they can be new conditions. So again, it's not really about oh, Mary complains of headaches all the time, so let's get an occupational health report just to find out why she complains about headaches all the time. Is that if my headaches is not interfering with my work and I'm just getting on with my life and my work, then invariably it's probably none of your business. However, if that headache is interfering with my work and my everyday activity, then there is an absolute need to investigate further, isn't it?
Yeah, absolutely. Absolutely right. Mary, we quite often call these triggers as to when you should consider using occupational health. And I'll guide you through some instances where it's probably worth speaking to a professional. They are not perfect, and they do come with a couple of risks that I'll guide you through towards the end as well. But generally speaking, if somebody presents with anything that is complex psychological or work-related musculoskeletal, work-related upper limb disorder, bad backs, those sorts of things, or they have a pattern of absence that represents a risk or a problem to the employer, that is the time to ask for help. Now, I mentioned that there are some risks associated with intervening with these sorts of things, and essentially it is because you have to be fair to the people that you are supporting within any business. So if Mary pops up and says, I have headaches, and occupational health support is accessed and delivered straight away, that's great. But if Susan, who sits next to Mary, has a similar issue and nothing is done, it is potentially discriminatory to Susan. So whatever happens to identify triggers, and on the absence sides of things, that might be if somebody has a repeat pattern of Monday-Friday syndrome, and goes over 6 or 7 instances, because that is abnormal, then, it's worth intervening, because you can access advice that says there is no underlying health condition. That means the HR professional or the line manager can then view the next time it happens as a conduct issue. It's amazing how quickly those sorts of things can settle where there may be pockets of absence. But, if Mary has 15 days of absence and nobody does anything, and Susan has 2 and she's referred to occupational health, that is a problem. So you always need to be mindful of whatever triggers are used to intervene, that they are fairly implemented across the team to avoid any perceived risk of discrimination.
Absolutely. And I think looking at the point of view of fairness, one of the easiest and most effective ways of addressing that is to have a process and guidance in place so that it's very transparent to all your employees and it's not a guarded secret in terms of only HR or line managers have got access to when these triggers or what these triggers are and when occupational health can effectively be tapped into to help the individual. And I think, again, looking at the very basics, why is occupational health reports or assessment important?
Absolutely, Mary. There's 2 parts to answering that question that I'll go through, because it's really important for your clientele to engage with their clients so that they can review absence policies and procedures, because it is such an easy area that can come back and cause significant risks and problems for your clients. So it's well worth just flagging up the conversation with any clients or with any prospects. When was the last time you looked at your absence policies? Because it is absolutely worth specifying in the policies what triggers may well result in a referral to occupational health. And to be fair, it doesn't have to be occupational health that's the outcome. It's where you will seek to get independent advice about the individual's health. You absolutely can write to a GP to get information about somebody's health. The reason that occupational health exists, though, is because it doesn't fall in the same regulatory or legislative framework as the normal treating clinician. So you'll know, if you write to an individual's GP, it falls through the Access to Medical Reports Act. It can take weeks and weeks to get information back from a GP, and the employee can insist that anything they don't want sharing is taken out of the information that's provided back. So it is there, but it's less than perfect. You will generally only ever get the employee's view of the world. Occupational health exists as a profession to bridge that gap. because we are not treating or diagnosing. That means we're not responsible for the individual's care, which in turn means we don't fall through the Access to Medical Reports Act framework, which means, we're a lot quicker to give information and advice back to an employer, and it is independent. It is not just recounting what the employee has said. Now,
I think on that very point, I think the same way as an employee can say to a GP, I'd like to review the letter or the report or whatever that you're going to give to my employer before you do it, which in my experience can be the cause of sometimes the length of time it takes for you to get that report back from a GP.
Yep.
Can an employee request to see the report an occupational health specialist writes, and can they request to withhold or redact certain information before it's shared with the employer?
Absolutely, yes, they can ask, but no occupational health provider is obliged to change anything unless it is factually incorrect. So, yes, every single occupational health provider in the country is obliged to offer the employee a copy of the report before it goes to their employer. Not everybody asks to see it. About 90% of people usually do. And the reason for that is we have to give the employee an opportunity to check the report for factual accuracy. That is a GMC stipulation. It's not just the Faculty of Occupational Medicine that suggests that is a good standard of practice. We have to do it. Everybody has to do it. However, some occupational health providers, including our business, take consent in advance of the report being sent to the employee. So we pre-consent, if you like, and we will say, if you'd like to see a copy, you must let us know. If they let us know, we've taken consent on the basis that if you do not contact us, 48 hours later, we will automatically release the report. And the reason for that is 48 hours is a perfectly reasonable time for anybody to review a report and check it for factual accuracy. So that's the first step towards making sure the reporting is done quickly. Now, an employee absolutely has the right to withdraw their consent at any time. There are consequences to the employee of doing so, and we are obliged to let them know. So if an employee comes to us and says, I would like you to change your report, the first default position is we don't have to. Anything that is presaged with the words, in my medical opinion, or in my professional opinion, we don't have to change it because it is just our opinion. But if the employee says, I'm really not happy with that going to occupational health, and I don't want you to release the report, we will always go back to them and say, that is your explicit right to withdraw the report. However, please do appreciate that means your employer will then be able to make whatever management decisions they deem as being reasonable without the benefit of medical advice or insight. Essentially, it means the employer can't then be sued for failing to support the individual if the individual is the one who will not allow them access to the information the employer needs to support them. There is plenty of case precedent to that effect. So generally speaking, if an employee withdraws consent, it sometimes actually gives the employer a freer hand in what might come next. Sorry, Mary, that happens about once or twice a year in our practice. Generally speaking, most employees have that light bulb moment and go, oh, okay, I'll let the report go. But, the nature of people is that we're dealing with human beings, and sometimes they'll just get to an entrenched position and dig their heels in, but it is rare.
Yeah, I think that is a very important point around the fact that, yes, it's within your right to give consent or withdraw your consent as the employee who is the subject matter of that occupational health report. However, if you do so, and I think the wording there, the warning there is very similar to what HR would give anyway, which is effectively would like to get an occupational health assessment done. Do you consent to it? It's your right, but if you do not consent, then the company effectively will make that decision based on the information they have. And that may be limited information, and it may not then go in your favor as an employee, because let's not forget the whole point of occupational health assessment And I think that is where sometimes the issues or the anxiety for employees come in, because the moment that request to refer to occupational health come in, people become nervous around why. And it's very important to give the assurance that it's not always requested to be used as a stick.
Absolutely, Mary. It's understandable. If people are told we'd like you to go to occupational health, some people have a deeply emotional response to it. And that's understandable. Nobody wants to think, oh my God, I might lose my job over this. However, if occupational health is positioned appropriately, most employees say that's great. They're really positive towards it. And the key is not to say to somebody, we want to send you to occupational health, because that can be perceived as threatening. However, if you say to an employee, we are concerned about you, we want to do all we can to support you, so we'd like to pay for professional medical advice to help guide us, most employees go, oh, thanks, boss, that's really kind. So it is all in the positioning. There is always a certain degree of carrot and stick involved in these sorts of things. It's amazing how much progress you can make with a slightly sharpened carrot as well. As long as the policies and rather the T's and C's and the staff handbook has words to the effect of, we reserve the right to seek an independent medical opinion, which is really common. Check with your clients whether they've got that, because it's an easy win for any advisor. And make sure that if the employee is feeling threatened, it's a supportive approach. If they want to say, I don't want to do that, you can guide them back to the T's and C's or the handbook and say, actually, it's a contractual obligation. If you don't go and do this, it's a conduct issue. Clearly not gross misconduct, but it gives you a different way of managing things. It is probably worth reflecting to your audience that these conversations sometimes can be really tricky. But as long as they are dispassionate, unemotional, and positioned as, we want to help, we want to support you, there is very little that the employee can do to flag, for example, a grievance about the process.
I think absolutely. And a lot of the time, requests for occupational health assessments come in, typically as part of a process or as part of an issue or concerns, etc. So it's not necessarily unwarranted that people would be anxious or nervous about it, because typically someone might be going through a grievance or absence management or disciplinary or something of some sort. There might be that issue that needs addressing as part of the process. And I think from HR point of view, long-term or even short-term absences can be part of the trigger for requesting for that. Because if someone is off sick, sometimes you just want to make sure, as part of that support process, that the person is fit to even engage in a disciplinary process, for example. So that might be the cause of it. Other times it may be as simple as somebody is presenting some symptoms or some conditions or something to you, and you're not quite sure whether the person falls under is classed as a disabled under the Disability Act. And you want to be able to have that understanding of what's going on with the employee, so that, again, you can either support them by making reasonable adjustments for them to help them to do their work properly, or to give them the support they need within the workplace. So it's really not all bad when that request or that referral is made. And a lot of the time, it really is made with the intention to support you, or even in a dispute situation, to find the best solution for that dispute.
Yeah, absolutely, Mary. And I know this will surprise you, that sometimes the second you say to somebody, your performance is not where we'd like it to be and we'd like to discuss a PIP, they're off. They've got stress, anxiety, depression. These things are really common, but there is
really lots
that can be done. Absolutely. There is lots that can be done about it. And it is not uncommon to want to understand, is the individual fit enough to participate in a disciplinary process? We would counsel, don't ask us that, because it is deeply emotive. The individual will feel threatened. They may put barriers up in the process. They might not turn up for the appointment, which makes everybody sad. There are things that make these steps much, much easier, though. And if your listeners and members think about asking questions like, is the individual fit enough to hold a rational business conversation? You will get the answer you need whilst diffusing all the tension and anxiety that sits around it. Because a disciplinary meeting categorically is a rational business conversation. Now, if you want to understand about things like if something's a disability or not, at the end of the day, that is only ever a legal decision. Only the courts can decide if somebody has a disability or not. However, it is occupational health's role to advise on whether something may be a disability. And to be fair, the threshold of if something's a disability or not is actually quite low. It really is. However, if the opinion of the clinician is, and we always use equivocal language like it may be a disability, it could be a disability, unless it is one of the conditions that is prescribed in the Act as definitively being a disability, like somebody with cancer or MS, absolutely, you should treat it like it is a disability. But that does not mean you are then managing things with one hand tied behind your back, because what the law says, as you know, is not you cannot dismiss on the grounds of capability if someone has a disability. It just says you must do all you can to accommodate the condition before you take the capability pathway. So as long as you can show we have tried, then that is a place where, if you've tried and things just aren't working, it's a capability pathway. Absolutely. No occupational health provider is ever going to take that decision for you, though, and no occupational health provider is ever going to say, and now you should dismiss. But if you have a think about what adjustments may be appropriate for the role or that the business could accommodate, there is nothing to stop you putting those into the questions you ask the occupational health professional. Because the purpose of any occupational health assessment is to answer your questions about your employee. And if one of those questions is, what can we do to support them? That's the reasonable adjustments question. You absolutely can go as far as saying, would it be appropriate to adjust their role temporarily so that they don't have any customer contact? If that's the preferred adjustment. And then you can get medical ratification that, yes, that is perfectly reasonable. Or no, for a medical reason, they should still keep having contact with customers. It's clearly a spurious example, but hopefully the more you think creatively about the outcome that your client would most easily accommodate, and if you then structure the questions you ask an occupational professional towards that outcome, it gives you a much better chance of a positive outcome in the report, rather than receiving a report that then makes you go, oh, great, now what?
And absolutely, I think on that note, I'd like to explore slightly what are some of the questions that HR professionals and employers should be asking occupational health professionals in order to get a meaningful and helpful report that they can then use to make informed decisions.
Absolutely, Mary. And sometimes it's very easy to overcomplicate these kinds of things. And there is I need to be very careful because I'm mindful. I don't want to completely offend an entire professional community, but sometimes there is a temptation to ask the same question in 19 different ways. Does the individual have an impairment? If the individual has an impairment, does it have a substantial impact on their day-to-day activities? These sorts of things. And sometimes we end up with 25 questions, subsection 2, paragraph 1 coming through. And it's really difficult because any occupational professional will have limited time. They have to go through every question with an employee. And if we get asked 20 questions, literally 20, the number, it'll take at least 20 minutes to go through every single question before we can even start to form an opinion. Wow. So it just puts pressure on everything. The temptation is to ask lots of questions. However, most employers will be able to proactively manage their health risks if they ask us usually 5 or 6 core questions, and they are common to any presenting issue. And the first one is, does the individual have an underlying condition?
Mhm.
And that is the cue towards, is this conduct or is it capability? Because if they keep taking time off and there's no underlying condition, and the answer comes back, no, there is no underlying condition, great, we'll manage it differently. The second question is then, are they being treated appropriately? Because if they are not, that's the occupational professional's cue to say, you might wish to consider engaging with the EAP. You might wish to consider encourage them to have talking therapy. Whatever intervention needs to be done, that's the cue to give you more information about this is what you need to encourage the employee to go and do next. The next question is, question number 3, is it work related? Have work tasks contributed to the problem? And that is, even though you may not want to know, that will help you manage your risks, because a large proportion of the answers are, no, work has not caused this. It is something in their personal life, which helps you then manage your risks with the employee in a very different way. The next question, number 4, should always be, what can we do to support the individual? You may wish to ask us about reasonable adjustments. We would counsel and advise. The law expects the employer to do all they can to support the individual, so position the question just as that. What can we do to support the individual? You will then get an answer generally about consider X, Y, Z steps. Occasionally, we have to say, there's nothing more you can do. And that's your cue to then say, okay, well, what comes next? The fifth question is then, are any changes we might consider making going to be temporary or permanent? And that gives you a prompt to, okay, well, let's adjust things on a temporary basis. If it is a permanent adjustment, you need to consider, can we make it or not? If you can, great. If you can't, that's the time to consider the capability route. You may not want to, but it is always a decision. If, for example, an adjustment is you need to change every single door frame in your building to accommodate a wheelchair, you have to consider, is it reasonable for us to do that or not?
I think that is absolutely where the size of organization in terms of funds, resources, etc., available to you comes in, because
Absolutely.
I think if it ends up in a tribunal of some sort, then if you're a large conglomerate, then you'll be expected to be able to make that reasonable adjustment because you can afford to do it. But if you're a very small organization, then invariably it might be a prohibitive cost to your organization, and it might be something that on that occasion you might not be able to do. But also I'd like to say a caution that sometimes just because you can't do one reasonable adjustment doesn't mean you can flat out rule out and say, okay, we can't employ you or we can't have you anywhere. You have to really explore all possible opportunities and options, regardless of the size of the organization, within reason.
You really do, Mary. These things are not, they are fraught with risk, and you cannot dismiss without some degree of risk. And if anybody has a disability that is deemed legally a disability, it is always going to be a difficult situation for any employer, because generally speaking, if you end up in front of a tribunal or, God forbid, an EAT, generally speaking, they will tend to side with the employees. And that is usually not without good reason, because what the law says is, if you have a disability, you have to accommodate it. What is reasonable is only ever decided on the basis of the facts of that individual case. And if your clients have 2 employees and they're a charity, what is reasonable for them is very different to if your Moneybags and Co. international banking organization that has almost limitless resources. So, it is worth discussing these things with your clients, with an employment law specialist as well, or even with an occupational specialist before you take any decisions. But generally speaking, as long as you can confidently demonstrate we have done all we possibly could to support the individual, the chances of hand grenades being thrown in your general direction are greatly diminished.
Absolutely. And thank you for that. So we've touched on the 5 questions that you should be asking to receive to get the right information that you need to help you to make informed decisions about.
Absolutely. The last question we need to touch on as well is critically important. Ask, is this a disability or not? And we'll give you an opinion, either yes or we think it may be, and that's your cue to treat it like it is, or no, it's not. And I would never be scared of knowing that something is a disability or not, because the law doesn't say you can't dismiss. It just says do all you can to help. And that's only right. Most employers want to help.
Yes. And in that same vein, are there red flags? Are there questions that, again, employers, HR professionals, and other people seeking occupational health advice should avoid asking?
Yes, they should absolutely 100% avoid asking anything that is not factually substantiated or is linked with information that hasn't been shared with the employee. And a classic example of that is, does their health condition explain their performance concerns? And if no performance concerns have been raised with the employee, that is an awful situation for any occupational clinician to be in, because the employee will only say, what concerns? Nobody's told me I'm doing a bad job. I disagree with that. That's outrageous. It will only lead in a grievance being raised, and it will possibly derail the entire assessment process, because if the individual flat out says that is not true, I haven't had any performance concerns raised with me, we might not be able to progress with the assessment itself.
Yeah.
Things that are worth being mindful of as well are future-looking questions can sometimes be really difficult to answer. So how long will this be a problem may not have a direct answer, because predicting what happens in healthcare sometimes is not an exact science. And God love them, all our doctors and nurses, when they left medical school all those years ago and went out into the world with their prescription pads and their stethoscopes, they were not equipped with a crystal ball. And sometimes the recovery times, rehabilitation times can vary greatly on what treatments may be available, whether the individual has engaged with treatment, and there are huge individual variations between people as well. So sometimes we may not be able to answer accurately how long will this be a problem. And please don't be frustrated if that happens. It is just because there is no reliable way to predict it.
In that case, I mean, on that particular subject, because I've come across it within the HR community, especially, and I think that sometimes and we'll come to what should you do with the report and how you interpret the content of the report shortly. But in that case, giving us, let's say I've got an employee who's been off work for 12 or 15 months with a bad back, and we've been doing all we can to support them. We've been communicating with them, etc. But the business really needs to understand when they can possibly be expected to come back to work, so that they can plan around resources, around supporting teams and all those sort of things. And I do appreciate that medicine is not exact science. And again, it's not a crystal ball. So I do understand that you can't give an exact, okay, well, she should be back in there within 2 weeks. Or giving us back pain is normally only like 6 months to 8 months. And Mary's been out for 15 months or so. She should really be back at work. And I know that's not the role of the occupational health professionals. What should employers do, or can they do anything?
Yeah, absolutely they can. And I'll come to that second. There's 2 components to this answer. The first thing is on bad backs, because we'll all have seen it present in the workplace at some time. And there is an inclination sometimes to go, oh, do you know, I could be so deeply cynical sometimes, Mary. If somebody says I've got a bad back, you go, really? Because it's so difficult to prove or disprove. Now, it is not anybody's professional role to say to somebody, I think you're lying. And actually, we should have a huge amount of deference to the employees that we're supporting, because the discs in the back have a really poor nerve supply and they have a really poor blood supply, which means it can sometimes take a long time for a back condition to present as a problem long after the damage has been done. And it can sometimes take a heinous amount of time to recover, because the back doesn't heal well. So if you have somebody with a bad back who's been off for months and months, you should be supportive and don't think they're lying, because they may well have a serious problem, but it doesn't mean the employer is stuck with the issue. Now, if you get a medical opinion from occupational health that says, we're not sure how long this is going to be a problem, they might need surgery, they might need more physiotherapy, but you may wish to consider, because nobody will ever say you have to do, you may wish to consider getting a review done in 3 months' time. Now, that doesn't mean the employer has to do it. All they have to do is consider it. And if you consider it and think we don't want to do, that's absolutely fine. But if you have a re-referral to occupational health, and generally speaking, most occupational health providers don't charge as much for review appointments because it takes less time. But if you have a review appointment in 3 months and ask the same question, how long is this going to be a problem? When will we have them back? And if the answer is, again, we still don't know, it might be another 8 weeks, it might be another 12 weeks, because it's dependent on lots of variable factors. At that point, the employer is in a much stronger position to consider a capability dismissal, because you've had a period of time where you've been trying to support the individual. You don't know how long it will take. You go through the machinations again, another 3 months down the line, and you still don't know how long it will be. The justification for capability at that point is then, who's to say we could go on another 3 months and still be in exactly the same position? So all the employer needs to do is build the picture as to why the decisions they're taking are reasonable in the context of their own business. And if it is a small business that has limited resources and limited personnel, and you just need the job doing, yeah, it's much more reasonable to dismiss at that point. But if you are Moneybags and Co Bank, you should probably think about maybe waiting for another 3 months before you take that judgment.
Yeah. Good. The next bit that we really looking at before we wrap up this episode is the assessment's been done. Let's assume consent has been given, and then the report is shared with the employer and the HR professional. What should they make of the report? And I'm overgeneralizing here, because every report for every individual and every condition is different. So I'm overgeneralizing here, but what should they expect from that report, and how should they interpret what they've been given?
Yeah, okay, absolutely. What they should expect from the report, at the minimum, is that every question they asked in the referral to occupational health has been answered. And if that hasn't happened, I wouldn't stew on it. Don't sit there and get angry and go, oh, bloody occupational health. Just go straight back to the provider and say, you were commissioned to answer these 8 questions and you've only answered 7 of them. Would you please answer number 8? That's the first step. Yeah. Now, there are language patterns that are always used, certainly across our practice, and they are very common in the occupational health profession. And they generally indicate, they are prompts for the referring manager to pick up what to do next. But, for example, we might well use language that the employee perceives that, the employee tells me that, ... And it might well be something that's potentially quite contentious, like, I've been bullied and harassed. My manager is the most unpleasant person on the planet, and I am the victim here. And if that should happen, we have to reflect it in the reports, because we are independent. We have to show we've done a fair, objective assessment of the circumstances. But we would always say the employee perceives that, the employee alleges that they've been harassed, bullied, whatever it may be. That is the employer's prompt to then say, oh, these are some serious allegations that have been made. Because with us saying the employee perceives or the employee tells us, we are not saying it is factually true. That's just what they've told us.
Yeah.
And if that is contentious or outrageous in the eyes of the employer, that is the time to give it to somebody else in the team if they can, or for the HR professional to suggest, we conduct an investigation here. That's your prompt to do something. Investigate the concerns, investigate the allegations, either, follow the ACAS code, either uphold the allegations or disagree with them. And if you disagree that the employee has been victimized, harassed, abused, whatever it may be, then draw a line under it and say, we followed the ACAS code here. This conversation, this element of the conversation is now closed, and we'd like to get back to the heart of the issue, which is the performance or the capability. So those are the common language patterns that are always deployed. And I wouldn't ever shy away from just saying, actually, I'm not sure what this means, or I'm not sure what to do next. Any professional occupational health provider will always include what's called report clarifications. So if you're not sure, or if you don't know what it means, go straight back to the provider and just say, can you explain this? They will not be able to share information that is new, so answer new questions based on what you've just learnt in the report, but they absolutely will be able to say, this is what's driving the information and advice in the report, or actually what that advice means is it's up to you what you do next.
Great. Thank you very much, Magnus, for that fascinating and sort of engaging discussion. And I think we can go on for a little bit longer, but I think it would be appropriate to wrap it up here. And then maybe we can pick up on another sort of discussion and maybe build on it. But before we wrap it up, would like to always end with some sort of top tips for getting it right effectively. So what are your 3 top tips?
The first one is, it is all about communication. Engage with the occupational provider. Nearly all providers should be comfortable having a conversation about a potential referral to occupational health before the paperwork is completed, to discuss the best questions to ask in the referral to occupational health. The second tip is engage with your professional community. Talk to the other HR independents about, how would you go about this? Or have you experienced anything like this before? And the third tip is, if you get a report from occupational health that has, in your eyes, made things harder, don't dwell on it. Go back to the provider, speak to them. There may be things that can be done. It is not always an absolutely closed off conversation, or at least it shouldn't be. Mary, I would like to thank you for inviting me to participate as well today. It is very rare that people say it's a fascinating conversation when it's about occupational health. But I would love to highlight, we are going to host a webinar with you in just a few weeks' time on these topics and more, with one of our senior doctors as well. So if any of the community have any medical questions that they'd like to run through, that is the time, and we'll always do all we can to help.
Great. Thank you very much once again, Magnus. And thank you everyone for tuning in, for listening, and for watching this episode. If you do have any questions in relation to occupational health that you'd like us to address, please send it in to us, and we'll be more than happy to do our best to address them. Or if you have any questions or topics that you'd like us to address that's not related to this, again, just send it in and we'll be happy to look at them as well. Would like to thank you for tuning in to HR Voices, and hope to see you or speak to you again soon. Thank you. Bye.
We hope you enjoyed this episode of HR Voices. If you have a topic you'd like us to cover, or would like to be a guest, we'd love to hear from you. Connect with us on social media or email us at hrvoices@hrindependence.co.uk. Tune in next time.